Hi, I'm Laurie McCauley with Optimum Pet Vitality. Welcome to Learn and Go with Laurie. In this session, we're going to be talking about using laser to treat through the skull to treat the brain. You say, can we do that? Of course we can. Our first study looks at using mice where they created a stroke and then used an LED, not even a laser, to treat them. And what they found was they were able to have more neurogenesis, so more nerve formation, better strength, better movement, and decreased stress. They used a 904 nanometer wavelength, something that's very common in our lasers. In the second study, they took mice and caused a traumatic brain injury, again something we see in humans and dogs, and they treated them with 810 nanometer wavelength, but instead of just saying, can we help them, they said, does the frequency matter? And they found that 10 hertz was much better at treating these mice than continuous wave or 100 hertz. So frequency matters. The next study looks at penetration. Can we really get into the brain of a dog or a human? And they found yes, we can. They took cadavers, dead people, and they looked at how much penetration lasers having a 940, an 808, and a 660 nanometer wavelength, how much penetration can we have? And they found that the 808 significantly more. It had over 40 millimeters penetration through the skull and into the brain. That's over 1.5 inches. That's pretty cool. And in our last study, I want you to think about this for our pets and our patients, using laser to treat the brain for depression and anxiety. In this study, they took humans with significant anxiety and depression, or one or the other, and what they did was they did one treatment with 810 nanometer wavelength, and they treated at F3 and F4. So those are special places on the head. And they said, let's treat this one time. We're going to check you again in 2 weeks. And they found it was really cool. 60% had remission of depression. So that's our HAM-D. And then 70% had remission, not just decrease, remission of anxiety. That's our HAM-A test. Now, by 4 weeks, nobody was in remission anymore, but they were still better than when they started. Wouldn't it be great if we could treat our pets or our patients with laser for anxiety and depression, even if we start out at every 2 to 4 weeks, and then hopefully be able to spread it out? Now, if you do acupuncture, I think in the dogs, we're looking at gallbladder 14. Now, you may look at it and pick a different point, but that's where I feel it. All right. I'm Laurie McCauley from Optimum Pet Vitality. I hope you had fun. I hope you learned something, and I'll see you next time.